Hi, my name is Andrea, and this presentation is to instruct patients on caring for abscesses. I am a registered nurse in the BSN program and just finished my clinical experience working at a family practice office with a nurse practitioner. While I worked at the clinic, I saw a lot of patients come in with abscesses that ranged in sizes. Many had come in thinking they had got bitten by a spider, had a bug bite, or a rash. I wanted to instruct patients on what to watch for, how to take care of, and the prevention of abscesses. Abscesses are pus or infective material in the skin. This can be after a wound, an injury, a boil, or folliculitis. Folliculitis is a hair follicle that causes an infection to the skin. The infections can be related to bacteria, like Staphylococcus bacteria, or can be more serious, like MRSA, methicillin-resistant Staphylococcus aureus. They can also be located in different areas of the body. Symptoms the patient may feel will be the skin may feel warm, tender, and raised. The raised bump may feel firm and appear red and swollen. Symptoms may also include fever and chills, which is a later phase in the infection. If the wound is open, there may be drainage, which can appear to be like pus or even bloody drainage. Risk factors for getting abscesses are patients who had been recently in jail or incarcerated, exposure to recent antibiotics, patients who play close contact sports, patients who are immunocompromised like HIV patients, children and young adults, especially those in daycare and in schools, the elderly, low socioeconomic backgrounds, and certain ethnic backgrounds are more susceptible to obtaining abscesses. The treatment depends on the provider. They may choose to incise and drain the abscess. Draining the abscess will relieve the pressure and the pain. If the abscess continues to grow or causes pain, the provider may choose to open the wound. If the procedure is performed, the wound will be cleaned with betadine and a small incision will be used to open the abscess. This allows the fluid to drain and a packing will be put in place to allow for further drainage and prevent the wound from closing prematurely. Packing is a long, string-like dressing that is sterile and woven much like gauze. The packing will take the place of the pus and allow for continuous drainage. A small amount of pus may be collected for a culture. A culture helps to identify the bacteria responsible for the infection to the skin and may assist the provider in prescribing the right antibiotics if indicated. The provider may or may not choose to prescribe antibiotics depending on the size and the patient. If you are immunocompromised, have a history of abscesses, or have a large abscess, you are most likely going to get antibiotics. The wound will be dressed with sterile gauze. Gauze is chosen because of the type of dressing allows for the wound to drain and is more absorbent than other dressings. You will see a small amount of packing at the wound. The provider will instruct you to return for a recheck to remove the packing and assess the wound. The packing is usually removed within 2 days. If there is still drainage after 2 days, the provider will replace the packing and request that you follow back up in another 2 days. You will also be instructed to apply warm, moist heat to the area to assist the abscess in draining. You should not squeeze or press on the wound. This causes further damage to the wound. You also want to keep the wound clean and dry. Make sure the dressing is intact. If it becomes soiled or moist, replace it with new sterile gauze, which is available over the counter at any pharmacy. The end of the wick should be left alone. While the patient has open, draining wound, they should not share towels or linen or be submerged in water. Friends and family should be instructed on good hand washing to prevent the spread of bacteria. The soil dressing should also be disposed of properly. When changing the dressing, you should remove the soil dressing. Make sure after the soil dressing is removed that you wash your hands before cleaning and opening the new sterile package. After the soil dressing is removed, make sure again that you wash your hands. Then you can clean the wound with normal saline. We want to clean gently, leaving the end of that wick alone. After the wound is clean, you want to open the package of the gauze. Make sure your gauze is the appropriate size for the size of the abscess. This is two sizes of gauze. This is a 2x2 gauze, and here's a 4x4 gauze. After the sterile gauze is in place, you can tape it down to secure the gauze. You want to make sure that you return if you have any signs of infection, which is any increased redness, any increased pain, warmth, if you develop a fever or more drainage or changes in the odor. You need to follow up sooner than the 2 days if you have any of these symptoms. Otherwise, you do need to follow up with your provider in 2 days. Prevention for bacterial infections is to see a provider early if you have any of these symptoms, any red bumps, or any concerns on your skin. Also seek medical attention for minor infections. Use good hand hygiene to prevent bacteria growth. You also want to use good hygiene and bathe daily. Proper hand washing is important to prevent spread of all infective wounds, and all friends and family should be taught about hand washing if someone in the house has a draining wound. If you are prescribed antibiotics, you should take the full extent of the medication even if the symptoms are gone and if the wound